Hi everyone, thanks for joining us today. So the University of Tasmania is just now doing a webinar series for all of our semester two starting studies. Today we're covering everything in the postgraduate study, dementia studies area. So if we can just jump on to the next slide. I'd just like to do an acknowledgement of country. Obviously we're doing this over webinar today, but just welcoming everyone from wherever they're joining us from and paying respects to the traditional owners of the land wherever you are today. Jump through to what we're going to speak about today. Today, we're going to cover all of our postgraduate study dementia care, why you might want to undertake study in postgraduate dementia, what your course options are, what you might like to study in those areas, any partner scholarships or just general scholarships that we might have that you might be able to take advantage of, and how to do so. We'll then move on along to how to apply and the process that you might go through, and we'll save our quick Q&A towards the end, but we'll also be answering any questions you have in the chat as we go. So I will pass you over to Emily, who will just introduce herself.
Hi everyone and welcome. So I'm the very new course coordinator for the postgraduate programs in the Wicking Dementia Centre. So I'm also a senior lecturer here and I teach into a number of the different units that we offer in the postgraduate programs. Currently that's the community and public health approaches to dementia unit. So as course coordinator, one of my key responsibilities is to oversee the teaching and assessment of the postgraduate dementia programs. And so I work closely with all the staff who teach into the postgraduate units. Like the other teaching staff, I spend some of my time undertaking research activities. And so students enrolled in the courses will hear about some of that research. So in my case, my research is particularly related to the support of people living with dementia through workforce education and translation of education into practice. But there are other staff who conduct research related to dementia cause and prevention. We have teaching staff from a whole range of different disciplines, and so we approach dementia from a range of different perspectives. So personally, my background is in biological anthropology and public health, but there are also staff who have backgrounds in neuroscience, psychology, occupational therapy, nursing, and social science backgrounds. So it's very diverse. So the courses we offer very much reflect that multidisciplinary perspective, which students are therefore able to benefit from. So why study a postgraduate dementia course? There are many reasons for this, but just three are highlighted on this slide. The first one is that dementia is a huge global public health challenge. So there are over 55 million people who have dementia worldwide, and over 60% of these people live in low and middle income countries. And every year there are more than or nearly around 10 million new cases. So the second major reason is to become an agent for change. So we need leaders in the workforce who have a comprehensive understanding of dementia, and that might range from neurobiology to policy and practice to effect meaningful change. Thirdly, studying a postgraduate dementia course will help to build stronger communities. For example, by being able to respond to the new 2024 to 2034 National Dementia Action Plan and the first of the three collective priority frameworks, which is going to be released shortly, hopefully. The plan applies to government, health and aged care providers, people living with dementia, their carers and families, the broader community, and to researchers. And last but not least, perhaps another reason is an excuse for a visit to Hobart in Tasmania. So this photo shows just a few of our graduates and staff members, and it was taken in the University of Tasmania Medical Science Building in the centre of Hobart, where the Wicking Dementia Centre is located. So many of our graduates do make it down to Hobart for their graduation ceremony, and it's really quite a highlight for the graduates and the teaching staff to meet in person. As well as the graduation ceremony, we usually host a morning or afternoon tea to meet other students and staff and hold tours of the research laboratories that are in our building where some of the neuroscience research is conducted. So to give you a snapshot of just one of the graduates of the Master of Dementia and her study and career pathway, I'd like to introduce Diane Cross on this slide. Diane followed a fairly typical pathway into the course because she started off doing the Understanding Dementia MOOC, or Massive Open Online Course, which you may have heard of. So in Diane's case, this was undertaken quite a while ago, before she then enrolled in our undergraduate programs and progressed right the way through to postgraduate. So you can read Diane's words on the slides, but I'll read them as well. In 2013, my passion for dementia care was ignited when I completed the Understanding Dementia MOOC. This initial spark led me to dive deeper into the field, enrolling in the Diploma of Dementia Care. My curiosity and love for learning about dementia only grew stronger, propelling me to pursue further studies. After successfully completing the diploma, I advanced to the associate degree, then the Bachelor of Dementia, and in 2024, I proudly graduated with a Master of Dementia. Each step of my educational journey has been incredibly rewarding and has profoundly enriched my understanding. Now, as a professional working with dementia services, this is for a not-for-profit aged care organisation, I apply the knowledge from every unit that I study to support and care for people living with dementia. It's a fulfilling and meaningful career that I'm deeply passionate about. So some of you might not be very aware of the Wicking Dementia Centre that is here at the University of Tasmania, so I'll just go over a little bit about what it's all about. I mentioned before that there's a multidisciplinary team involved with teaching into the postgraduate programs, but this multidisciplinary approach extends to the whole Wicking Centre. So the Wicking Dementia Centre aims to better understand the brain diseases that cause progressive decline in functioning, affecting memory, problem-solving skills, function, and social behaviour. Develop evidence-based approaches to improve the lives of people with dementia and their carers. Determine how to reduce the risk of dementia by building resilience throughout ageing. And of course, the Wicking Centre offers a whole range of educational programs to build knowledge and understanding of dementia within the community. So as well as our award courses like the postgraduate ones that is the focus of today's presentation, you might have heard of or even studied some of our other education offerings like the free Understanding Dementia Massive Open Online Course, or MOOC, which has now had well over 420,000 enrolments. The Preventing Dementia MOOC, the Understanding Traumatic Brain Injury MOOC, and this year we also have the Parkinson's MOOC and the Motor Neurone Disease MOOC. So we've got quite a range there. Last year, the Wicking Dementia Centre suite of aged and dementia care courses, including the postgraduate courses, received official accreditation from Alzheimer's Disease International. So this makes the centre the first Australian institution to receive this recognition for its global leadership in dementia education. Accreditation recognises the Wicking Centre's dedication to excellence and its commitment to enhancing care standards worldwide. So we have 3 study options for postgraduate dementia study. There's the Graduate Certificate in Dementia, the Graduate Diploma of Dementia, and the Master of Dementia. And all of these are online courses, so that really gives you the flexibility to be able to study from wherever you're located. The Graduate Certificate in Dementia is a minimum half-year course, that is if it's studied full-time, and it can extend up to 2 years if it's studied part-time. And most of our students are actually studying part-time. It aims to provide you with a cross-disciplinary understanding of dementia and its impact on individuals, societies, and governments across 4 themes. And so these 4 themes are health and social care in dementia, the neurobiology of dementia, policies and systems in dementia, and community and public health approaches to dementia. And I will go over these in a bit more detail a little later on. The Graduate Diploma of Dementia is a minimum 1-year course. So again, that's if it's studied full-time, but it can extend up to 3 years when it's studied part-time. And that aims to build on your existing knowledge and develop your research and critical skills. It will also enable you to delve much deeper into 3 of those 4 themes that I just mentioned. The Master of Dementia is a minimum 1.5-year course if it's studied full-time and can extend up to 4 years when studied part-time. So by progressing to this level, you'll be able to complete a major project in your preferred area of interest and explore 2 of those 4 themes that I mentioned at an advanced level. So the entry requirements you can see there, they're listed on the bottom of the slide. For any of the courses, you'll need a bachelor degree in a health discipline, social work, or psychology. Or if you don't have that, a bachelor degree in another field together with either at least 1 year of full-time relevant work experience or successful prior completions of 4 Diploma of Dementia Care units is required. So as well as these entry requirements, we also recommend that postgrad candidates complete the free Understanding Dementia MOOC prior to enrolment if your previous degree was not related to dementia. So you can find out about all of our MOOCs by going to mooc.utas.edu.au. So the postgraduate dementia qualifications are stackable so that you can progress through your study in quite manageable stages while being able to exit along the way with a graduate certificate or graduate diploma if you don't wish to continue on to the master's. So at the graduate certificate level, you'll study 4 core units covering each of the 4 themes of health and social care and dementia, the neurobiology of dementia, policies and systems in dementia, and community and public health approaches to dementia. So this will give you 50 credit points as each unit is worth 12.5 credit points. At the next stage of the study journey to bring you up to graduate diploma level, you'll study 1 core unit and you'll choose 3 units to study from the 3 themes, which you feel perhaps are most useful or most interesting to you. The core unit is a research-oriented unit, and that will help you to be able to explore, understand, and also critically evaluate the evidence base in relation to dementia. So together, these units will give you an additional 50 credit points. So to finish your study journey at the master's level, you'll need to study another 2 units chosen from the 3 themes that you studied earlier, as well as another core research-oriented unit. And this time, the core research unit at the master's level is a double unit, so it's worth 25 credit points of study. So you can choose a topic that's really relevant to your own context to really focus on in depth. So in total, you'll have achieved 150 credit points by the end of the master's, so if you choose to progress that far. So here are those 4 key themes again that I've been mentioning along the way in a bit more detail now. So they are health and social care and dementia, neurobiology, policies and systems, and community and public health approaches. And so together, these are going to strengthen your understanding of dementia from multiple perspectives. So health and social care and dementia will encourage you to explore approaches to supporting people living with dementia to maintain healthy lives using a holistic and human rights-based approach. The neurobiology of dementia theme will enable you to gain a deeper understanding of the diseases that cause dementia. So for example, Alzheimer's disease, frontotemporal dementia, and vascular dementia by examining function and dysfunction of the brain. Under the policies and systems in dementia theme, you'll examine the systems and policies which underpin local, national, and global approaches to dementia and their major drivers. Finally, the community and public health approaches to dementia theme will cover community and public health strategies to reduce the risk of dementia and maximise quality of life for people living with dementia. And this theme has a strong focus on health equity. So all students will study a unit from each of these 4 themes in the earliest stage of study, while those students who progress through to the mid-level units choose units from 3 of the 4 themes, and those who progress right the way through to the master's choose 2 of the 4 themes to study at an advanced level in their final period of study. So a common thread which runs through all of these 4 themes and which is further developed through those core research-oriented units that I mentioned at the graduate diploma and master's level is research literacy. So this will build and refine your skills in critical evaluation of evidence, application, and design of research. So you might be wondering where all of this study will lead you. So the career outcomes for those who've undertaken postgrad dementia studies are really varied and diverse. So depending on your background and your experience, career opportunities might include leadership roles in the health, community, or aged care sector, designing and implementing dementia-related policy in the public or private sector, senior industry roles, or for those students who have a health professional background, clinical roles and clinical leadership, which will help drive evidence-based practice and clinical redesign in dementia support. Advocacy or advisory roles in the health, community, or aged care sector are also a career choice. And a pathway towards research higher degrees or other research-focused roles, drawing on the research design and critical evaluation skills that you will have built throughout your studies. And I guess one of my observations from teaching into the core research-oriented units is that students can actually develop a new and much more appreciative attitude towards research, where they really get to understand its value and its impact for dementia. So in summary, we hope that studying dementia at the postgraduate level will facilitate you to be an agent of change in dementia policy, care and support, services, and education. So our Master of Dementia course provides a global perspective on the impact of dementia on individuals and societies. It's aimed at graduates and professionals who are currently working within or building their expertise in dementia or a related field. So we have students studying the postgraduate programs from many different locations across Australia and overseas, and from many varied backgrounds. So most students are already in the workforce while they're studying, with many studying part-time. And just to give an example of some of the roles of current students, they include respite and adult day program coordinators, dementia educators, residential aged care facility staff and managers, clinical and registered nurses, allied health professionals, policymakers, general practitioners, home care workers, family carers, and also we have retirees and volunteers who are active in the advocacy space. So yeah, we have a very broad range of students. So on this slide, you can see pictured just 3 of our graduates from the Wicking Centre dementia programs. We also offer undergraduate dementia programs. So some students progress from these into the postgraduate programs like Diane did. So Kim and Elizabeth on this slide are Bachelor of Dementia Care graduates, and you're already familiar with Diane, who's the Master of Dementia graduate. Diane is one of the over 160 graduates since the postgrad program was first available from mid-2019. So I'd like now to talk a little bit about how you will actually learn as a postgraduate dementia student. So each unit will give you an opportunity to learn through a mix of online modules, self-directed learning, discussion, and varied assessment tasks. So overall, you can expect to need to set aside up to 10 hours of study per week for each unit, although this will vary a bit from unit to unit, and it will also vary a bit across the course of the semester. So online content is delivered over the course of the unit, and you'll be able to engage with peers and teaching staff through online discussions and webinars. And in fact, this opportunity to engage with peers through online discussions and webinars is often one of the highlights of study for students. So as our courses are online and open to people across Australia and overseas who are active in different sectors and areas, there's a wide diversity of students. So I've already mentioned some of the types of careers and activities our students are involved with while they study, such as registered nurses, allied health practitioners, and family carers. So even when some students might be a little reticent to actually contribute a lot to the online discussion boards, they've told me that they really love reading everyone else's discussion board posts, and it makes them feel as though they belong to a community of learners, all of whom are really passionate about dementia. So they really enjoy finding out about the varied roles, experiences, and perspectives of their fellow students and learning from and with each other. So you can expect a lot of learning to be self-directed, as this is a postgraduate study. So you'll have reading, including journal articles, interactive discussions, recorded lectures, and other learning activities to complete. And these are all available via the university's online learning platform, and this is called Milo. There'll be detailed instructions and reading provided to guide you though, so don't worry too much about that. Every unit is assessed, but the methods vary again across units. So typically there are around 4 assessment tasks per unit, but again, this does vary. There might be written assignments like essays and literature reviews, online multiple choice and short answer quizzes, discussion board interaction, or there might be oral presentations. Often there'll be an opportunity for you to link what you're learning to your own personal context. And students tell us that they really appreciate the opportunity to be able to do this. So on this slide, I've got a few quotes that I'd like to share from students about the result of all of this study on their day-to-day practice. And this was taken from a small research survey that was conducted recently. So in general, student survey participants indicated that postgraduate study has resulted in a greater ability to use the evidence base to support practice, has developed their confidence and strategies to educate others, and has built dementia care and support skills. And this was happening while they were still studying. So the first quote is from a clinical nurse consultant who writes about how every day working with patients, informal carers and communities, this person is able to use coursework to explain, support, teach, advocate and improve outcomes for people living with dementia. The second quote's from a student working in education and training who states how the course has given them confidence to think critically and challenge practices that are not evidence-based. Finally, the third quote's from a dementia advisor who states that they're now more confident to approach the leadership team with ideas for change because they have the knowledge and the information from the course to back them. So on this slide, we've just got like 4 key questions which students are often interested in. So you can see there, I've already mentioned this in terms of how much time should be spent studying. So you should anticipate spending up to around 10 hours per week per unit. Another question that's often asked is whether or not all of the unit activities can be compressed into a few weeks. The units do vary, but most deliver the content weekly or in modules. So you can't really compress it all to that extent. And assessment tasks are actually undertaken and need to be submitted throughout the course of the semester. Another question that is often asked is around how many units to enroll in a semester. So a full-time load is 4 units, but given that a lot of the students are actually working part-time, we highly recommend that you only do 1 or 2 units if you are working full-time. Otherwise, it's going to be very difficult to manage. And then, do I need to commit to a specific study time every week? This is, again, one of the benefits of being an online course. There's no fixed time that you must participate each week, but we recommend that you do carve out some regular time to manage your workload. And that's going to depend very much on your other activities outside of study. Okay, so we do actually offer some Health Partner HEX scholarships. So there's information about that on this slide. So if you do work for an eligible healthcare provider, we do offer generous HEX fee waivers or fee discounts to support you with the cost of study. And you can actually search to see whether or not your employer is listed there on the website. And yeah, so it's got instructions here, so you can work your way through that. You also need to be eligible for a Commonwealth supported place and complete a Health Partner Employee Declaration when you enrol in the course. Okay, and I think that's it from me. So I'll hand back over to you, Ira.
Great. Thank you, Emma. So for those of you who are looking to apply for semester 2, if you'd like to study in semester 2, applications are now open. You can apply yourself or you can contact us to help you apply. We're happy to give you a hand in any way that you need. Once you have applied, you'll then receive an offer. So that offer may come with some conditions. It might be conditional on scholarships and things like that. Again, if you have any questions, please contact us. And then you'll be able to enrol in your units for a start of the 25th of July is when semester 2 will start. So if you need any help along that way, you can give us a call on 138827, which is 13 UTAS, or send us an email to course.info@utas.edu.au and we can go through any details. A lot of the time, these details will be very precise to individuals. So it's good for us to sit down with you over the phone and actually go through any concerns you have for your personal application. So we're happy to do that. Please reach out if you need a hand with anything like that. So that's everything. We'll jump to the next slide, which is just going to be our Q&A. If you need any help with anything or if you have any questions now, please feel free to ask. Emma and some of our colleagues will answer your questions that you put in the chat for us now. If anything is too specific, then we might get you to reach out or we'll reach out to you and we'll go through the details, your personal details or your personal circumstances to actually get a better understanding and answer the question as best we can. If you have any questions, put them in the chat. I can see one there. Petra, we might actually just get to your email that we've got there. It's quite specific to you. So if there is something very specific, then we'll reply via email and we'll get in contact with you. And that's probably one question there that we'll do that for. Unless there's anything very general, Emma, that you want to answer from that question in the chat. Okay, that's all good. We don't have any questions in the chat at the moment. Please feel free to send through any questions that you have to us. You'll also get a recording of this webinar sent to your email as a follow-up. Other than that, that's us done. Thank you for joining us today. If you have any questions, please feel free to reach out. Thank you very much.